thank you again for the opportunity to present our work, which actually was funded by AMDA. So thank you very much, AMDA, for making this possible. And I hope I'll present data that convinces you that this was money well spent. These are my disclosures that you saw yesterday, and the rationale, as you've heard the last 2 days, and from Nina's recent presentation, is that the enzyme is not currently targeting the muscle glycogen, and so we need improved adjuvant therapy. And I presented this to you yesterday, that patients, even on ERT, are declining in their muscle function, as you see in the 6-minute walk test here. And this may well be related to the autophagic debris that you have seen and heard about in the previous presentation. So the hypothesis for our talk was if we reduce the substrate, if we reduce the amount of glycogen that's in the muscle, then maybe whatever residual enzyme that the person is producing will be able to target whatever remaining glycogen there is. And the premise also depended on previous study, or was based on previous study, actually Nina Rabin's group. There were 2 studies they did. So what glycogen synthase is, it's an enzyme that produces glycogen, and there are 2 types of it: glycogen in the liver, glycogen synthase in the liver, which you don't really want to target, and glycogen synthase in the muscle. And what they did was they targeted glycogen synthase 1 in the muscle by injecting the muscle of these newborn mice with a virus that carried these oligonucleotides, and they were targeted with peptides, and they showed that there was reduction in the glycogen, and it didn't seem to harm the mice. They also made a knockout mouse. They knocked out the glycogen synthase 1, and again showed that there were benefits in the glycogen, and it didn't seem to affect the mice too much. So the theory then is that if you knock out the glycogen synthase that you see in the arrow pointing to the left, you will reduce the amount of glycogen that's produced, and then it will, it'll bypass this reduced glycogen, and you will have improvement in the pathology. So we partnered with Ionis, which is a very well-known company now, because they make Spinraza, which has been basically the first antisense oligo that has been approved, and it seems to be safe. And what it is, and Dr. Reuser also told you about it. So it's a little piece of RNA that attaches onto your gene of interest, prevents translation into protein, and therefore knocks down. So you get no glycogen. That's the theory. So we had already got these ASOs from Ionis, and they had studied them in the lab in normal mice, and showed that there was indeed a reduction of glycogen 1 synthase, messenger RNA, as you see in the muscle and the liver. So we used these. We had also got a lot of natural history data on Dr. Rabin's mice, as you see here, that they seem to be okay till about 7 months, and then they decline pretty rapidly as they accumulate glycogen in their muscle and their skeletal muscles, in their heart and skeletal muscles. So this was our aim 1 for our study, and we started them at 1 month and treated them once a week with 25 milligrams per kilo, and then monitored them for 16 doses. And then sacrificed them and studied their RNA for the glycogen synthase 1, glycogen, and then other autophagy markers. And this is what we saw. So after so mismatch is just a sort of untargeted, non-specific antisense, and PBS is just basically saline. And we saw that there was a reduction in the glycogen synthase, and glycogen synthase 1 and 2, more markedly in 2. And then we monitored the weight loss for toxicity, and we also monitored liver function tests, kidney function tests, et cetera, the whole metabolic profile. What we saw that there was a little bit of reduction in the weight with glycogen synthase, with the ASO2. And so at this stage, ASO1 was our favorite, and then the company made us an ASO3, and the data I'm showing you is with all three combined. And what you see here is really dramatic improvements. So towards the right is PBS and wild type, and then mismatch sort of moving into the center, where you're seeing glycogen synthase expressed, and then with the ASOs 1, 2, and 3, there is almost no glycogen expressed, and you're seeing that LC3 also is reduced significantly, which is an autophagosome marker. P62 is an autophagy marker, and you see improvement there. And then mTOR actually showed that it was reaching, it's not really very clear what effect it has, and we have to do a little more studies, but it appeared to be reaching the wild type level with ASO3, as you see there. So looking at the glycogen content in the muscle quadriceps, lysates, what you see from left to right is baseline, PBS, mismatch, and then the three ASOs to the right. And you're seeing that there is a reduction of the glycogen content, particularly with ASO 1 and 3, but not so much with ASO 2, which, if you remember, was also the one that causes weight loss. And this is a PS staining of the muscle, and you can see that ASO 3 is not quite reaching wild type levels, but is way better than what you see with a mismatch ASO. So this was our aim 2. So that was starting at 1 month, and our aim 2 was, can we revert the damage that has already occurred? And so we started treating them at 3 months, and then monitored them at regular intervals, and then at the end of the 9-month period, we analyzed the muscle, the heart, liver. We also, of course, looked at the functional studies throughout the study, and this study is still ongoing. Our grant isn't entirely spent out. We're funded through the end of the year. So these are the results from one of those ASOs, the more recent one. And what you see there is that starting, having difficulty seeing it. Baseline is a 3, 6, and 9 months. That compared to mismatch, that there seems to be an improvement. Maybe not so much at 3 and 6 months, but at the latter part of the period that we're seeing some improvement there. When we combine all three ASOs compared to mismatch and PBS, you're seeing improvements with ASO 1 and 3, but not so much with 2. But also there are big error bars. So the work needs to still continue to get really good, clean data. So this is a summary slide of those three ASOs. We saw no toxicity with 1 and 3. The GYS1 messenger RNA was reduced, although it was more drastically reduced in 2. It appeared to be more toxic. These mice could not be tested really for strength because they were weak, and it shows partial clearance of the glycogen. What we also studied was the spinal cord, and we found that, not surprisingly, that the spinal cord pathology, which was very abnormal in the untreated mice, was very similar with the ASO-treated mice. And so this is something that needs to be targeted, and we're now recognizing that the central nervous system pathology is really important in the progression of Pompe disease. So these are our future plans. We're going to complete our studies with the ASOs. And having heard Dr. Rabin's talk, even 1 month is perhaps too late to start treatment. We need to be starting even earlier, particularly since some of these ASOs seem to be safe. We are planning on combining, perhaps with the best GA enzyme replacement and the combined GYS1 ASO. And then it's really important to target the central nervous system. And I believe that this has good potential for a clinical trial in the future. And these are the acknowledgements, AMDA for giving us the funds to do it. Dr. Weiss also got a T32 to work on this, and members of my lab. So that's it. Thank you.